Good afternoon. My name is Susana Palma, and I am going to show you a case of class 2 canine, class 1 in molars, with a tendency to open bite and with a compression of the upper and the lower arch. When we see a case like this, the first thing we think is that if we try to correct the crowding by proclination of this upper incisor and lower incisor, we are going to increase the open bite. We check that the patient has the possibility of transversal compensation of the arches, and there is a lingual torque in the canine, premolars, and molars. So we know that we can provide some space, making some dentoalveolar expansion in the upper and in the lower arch. We also have to take into account the rotation of this lateral incisor that has a problem of rotation, tipping, and also is intruded. So we'll have to provide a vertical movement at the same time that we will have to correct the tipping and the rotation. And we must know that we have to ask the CAD designer not to do the movement, all of them at the same time, or we will have misfitting of the aligner in the lateral incisor. So every time that we check a clean check, the first thing we like to check is the occlusal view. So we check in our patient that we have this upper compression of the upper arch, that we are going to be able just to correct by labial crown tipping of these premolars and molars. And in order to provide the space to correct the upper crowding, we'll ask for simultaneous distalization and expansion of the lateral zone, providing space for the upper incisor. In the moment that we are proclining this incisor, we help ourselves with this palatal attachment in order to provide anchorage in the anterior zone for the distalization. Also check that we are going to make it equal, the torque of the four upper incisor, before starting the relative extrusion of them. In the lower arch, we are going to make this also a sequential distalization of the lower arch at the same time that we are distalizing the upper arch. In this way, we will provide the space that we need without creating any protrusion of the lower incisor. Check the initial position, and this is the final position that we are going to ask in our patient. We are going to center the lower midline to the right at the same time that we are retruding those incisors. If we check from the anterior point of view, we can see that we are distalizing the posterior teeth at the same time that we are applying labial crown torque of these premolars and molar. And this lateral incisor, you can check from a lateral view that we are going to first provide a space before starting the movement of them. And in the moment that we have a space, we make it equal the torque of the four upper incisor, and then we correct the extrusion by relative extrusion, by retruding at the same time that we are extruding. So this is the way that we are correcting a class 1 relationship that has a lot of crowding and that we want to prevent the patient from recession in the incisor due to proclination, and we want to correct the anterior open bite.